Like most mothers, Jemana simply wants the best for her child.
When Guilherme was born and we got the diagnosis, I had to leave my job. Then we had no income and our costs multiplied by 3, because having a child raises the expenses and having a child with special needs triples it.
Jemana is far from being alone. More than 2,600 babies were born with microcephaly or other health issues linked to the Zika virus during an outbreak in Brazil. And the public health emergency hit during the country's worst recession in decades. Human Rights Watch says the epidemic forced authorities to make difficult budgetary decisions, but that investing in water and sanitation during earlier times of economic growth could have prevented the mosquito-borne virus from spreading as quickly as it did. More than 1/3 of the population lacks full access to water, and 35 million people in Brazil lack adequate access to toilets. Human Rights Watch says addressing these underlying issues can help prevent the virus from spreading.
The world has moved on, but these families haven't. These families are trying to lovingly provide the highest quality of care for children that are no longer babies, children that have lots of needs. And a lot of these families are more in crisis than they were at the beginning, simply because the world has forgotten about them.
Human Rights Watch says Brazilians' basic human rights are at risk if the government doesn't reduce mosquito infestation over the long term and secure access to reproductive rights and support families raising children affected by Zika. The number of Zika cases this year has dropped dramatically, but nobody knows exactly why. Human Rights Watch says improving infrastructure and public health can help prevent another epidemic as mosquito season amps up in the Americas. Kerry Alexandra, TRT World.